Okay, so we reached the final section within chapter 14. We're going to talk just briefly on the disorders of the autonomic nervous system. So many autonomic nervous system disorders involve a deficit in the control over smooth muscle activity. So the first disorder that we need to talk about is hypertension, which is pretty prevalent, especially in the United States, which is basically having consistently high blood pressure. This can be the result of an overactive sympathetic vasoconstrictor response to stress, and the heart's going to have to work harder, which means that the artery walls are going to be subject to increased wear and tear. However, it can be treated with adrenergic receptor blocking drugs. The second disorder I just want to touch on is Raynaud's disease. It's pretty painful. It's exaggerated vasoconstriction in both your fingers and your toes to the point where your fingers and toes actually turn pale and cyanotic, which means they appear blue in color. And it's painful and it can lead to gangrene, which is tissue damage if left untreated. Um, but for treatment, we can use vasodilators to help get a blood flow back into our fingers and toes. The third disorder is autonomic dysreflexia. This is life-threatening. It's uncontrolled activation of the autonomic neurons in quadriplegics and people with spinal cord injuries that are above T6, in which case your blood pressure is going to skyrocket, posing increased risk for stroke. So the trigger causes a high blood pressure in response to painful stimulus on the skin, or even just a full bladder can cause your blood pressure to skyrocket. And this is just a picture of Raynaud's disease, where we can see we have vasoconstriction and not enough blood flow in our fingers right here. And that's it for chapter 14.